Good evening to all of you. This is a second cervical vertebra. This is called axis, as because one pivot is there, and this pivot is called adenoid process or also called dens. This is the second cervical vertebra. The identifying point is the foramen transversarium is there, and this is the superior surface. This is superior surface where this portion articulates with the first cervical vertebra, that is atlas, and this is inferior surface. The identifying point is the articular facet of the superior surface is convex and is just adjacent to the axis, just adjacent to the adenoid process. And the inferior surface, the articular facet is far apart and is of looking lateral. Inferior surface, the articular facet looks laterally and is far apart in comparison to the superior surface. Superior surface, the articular facet is convex and is very close to each other. And this is the foramen transversarium. This is the aspinous process. One more identifying point of the cervical vertebra is the aspinous process is bifid. This is the vertebral foramen. This is the vertebral foramen. And this is the body. This is the body. Body articulates, body attached with the vertebral arch. That portion is called pedicle or base. And this is the lamina. Now I want to discuss the thoracic vertebra. The features by which I can identify the thoracic vertebra. First, the common features of the vertebra must be present, like body must be there, vertebral foramen must be there, transverse process is there. This is the aspinous process, and this is the articular surface, superior articular surface. This is an inferior articular surface. The identifying point of the thoracic vertebra is the costal facet is present on the body. This one is the identifying point where we can identify this vertebra, thoracic vertebra, from the cervical or lumbar or sacral. This is the costal facet which is present on the body, and one more facet is there, is on the transverse process, and the shape of the body is heart shaped. Shape of the body is heart shaped. It's like this. This is also the thoracic vertebra. This is also the thoracic vertebra, as because the costal facet is there and the shape of the body is heart shaped, and the foramen, vertebral foramen, is of circular. This is of circular. This is of circular. This is the vertebral foramen. The shape of the vertebral foramen is circular. This is also the thoracic vertebra, and the shape of the vertebra is, shape of the vertebral foramen is circular. These are the identifying point. With the help of these identifying point, we can identify this is the thoracic vertebra. That's all. I want to discuss the lumbar vertebra. How I know this is a lumbar vertebra? The common feature of the vertebra which is present. That means the body is present. This is the vertebral foramen. This is the transverse process. This is the spinous process. This is the superior articular surface. This is the superior portion, and this is the inferior surface. And body must be is on the anterior side. This body is must be on the anterior side, and the spinous process is on the posterior side. The identifying point of the lumbar vertebra is the body is of kidney shaped. The body is of kidney shaped. This is the kidney shaped body, and is a large body size is comparatively large in comparison to other vertebra. And this is the transverse process. This is the spinous process. The spinous process is very short and blunt, and this is the articular facet. This is a superior articular facet. How I know that this is a superior articular facet? First thing, the body must be is on the anterior, and the vertebral arch is on the posterior side. The superior articular facet is of concave and looking towards the posteriorly. This is the concave facet and looking posteriorly. And the distance between two articular facet which is present on the superior is more in comparison to the inferior articular surface. Inferior articular facet. And the distance between inferior articular facet is less in comparison to the superior articular facet. And one more thing is present in the lumbar vertebra is mammillary bodies. These are the mammillary bodies. and one more body is there, is the accessory body. These are the identifying point which is present only in the lumbar vertebra. And the shape of the vertebral foramen is triangular. Is a triangular. This is a triangular vertebral foramen. This is the vertebral foramen which is triangular. That's all.